It to me, Lewis. Alrighty, hey everybody, it is Jill and Dr. Grant Tully here, and we're just going to hold tight a few minutes. I know people are probably just now getting our notification. We're just getting some notes here, and we'll be ready to talk about incontinence today.
Who doesn't want to talk about incontinence?
Alright, and then could you just make sure that we are where we need to be there, Lewis?
Yep.
Alright, so if anyone is joining us, make sure you comment. Lewis is behind the camera here, so if there's a question that pops up, he'll be able to let us know as well. Do we have anybody watching? We have people joining us yet? Okay. So whoever that one person is, hello. Hopefully you'll say hi to us. Now we're trying to get some notes here. So every week, Wednesday, Dr. Grant is we're going to talk about a topic.
Mm-hmm.
We have some topics in mind, but if there's something specific that you want us to cover, maybe it's upcoming, but write it in the comments.
Ashley Morales says hello.
Hello, Ashley. We just saw you this morning. But if there's a topic that you maybe want us to cover and we haven't thought about it, make sure you put it in the comments and we can check our list, and if it's not on there, we'll add it. All right, Lewis, now I can't actually get to our notes. What's going on?
I run to my phone, but I hung up.
All right. That's the document that I want. There we go. All right. So why don't we start and tell us a little bit about Advanced Animal Chiropractic, in case everyone missed us last week.
Okay. So Advanced Animal Chiropractic, it's our business. It was founded by Dr. Christina Cole. It has been in practice actually coming up 5 years.
Wow.
I think
That's exciting.
In May, yeah.
Congratulations on 5 years.
Thank you. But we serve Southeast Michigan. We probably do about an hour and a half radius around, we'll say, Troy. Mm-hmm. But most of our major locations are within
Metro Detroit area.
The Metro Detroit area, yeah. And we see predominantly cats, dogs, horses, although we have been known to see a few other animals as well.
Sure.
And I'll share that story, my story of the week,
Yeah.
up here in a second. But we are practice. All we do is animal chiropractic. We recommend maybe some rehab and some other supplements, depending on the condition as well. But in general, yeah, we're board certified animal chiropractors, and this is all we do. We get pretty good results doing it.
Perfect. So tell us a little bit about your credentials. So I know you mentioned you were board certified.
Yep. Okay. So Dr. Cole and I are both. First, you go through undergrad. You get your degree. My undergraduate degree is in biomedical science. Then we both went to chiropractic school. So that is a 4-year doctorate. After you graduate from chiropractic school, you become board certified. The additional training we went to is in Kansas. It was called Options for Animals. Mm-hmm. It is for us, we did it, there's multiple ways to do it, but we did it 6 weeks straight. It's basically 6 days on, 1 day off for some additional hands-on homework, because it's hands-on every day.
Sure.
But at the end of that program, you test with them, and then they had the International Veterinary Chiropractic Association come in afterwards. So if you pass their test, then you get the test for the International Veterinary Chiropractic Association. And if you test that, you become board certified. And so there are 2 major boards, the International Veterinary Chiropractic Association and the American Veterinary Chiropractic Association. If you're looking for an animal chiropractor and you're not local, those are the organizations you want to check out.
Perfect. And I know we've had people call from all over the United States, so
yeah,
those websites are very, very helpful to people that are maybe not local.
Mm-hmm.
So, good. And then I know we were going to talk about a success story. It's not really a success story. It's a some new animals that you're helping. So give us a lowdown.
Yeah, we had an interesting success story. We had 2 show steer that I saw last week.
Awesome.
They were less than 1 year old, but they were big, and they were having some issues with their gait. So if they're not working perfectly or walking perfectly at an event, it might drive down their price. So the owner had us out there to adjust them, to help out with that. They had some hip issues among some other things, but it was.
And how was it adjusting show steers?
It's different. So the closest thing we have are horses. Horses are pretty used to being handled.
Right.
Not that these show steer aren't.
Right.
But horses have a little bit different temperament. But
I think there's a little bit more emotion that goes behind it too. Being with such a large animal,
Mm-hmm.
I mean, they could hurt you or harm you.
Yeah. So it was. I mean, it was different. The anatomy, while similar, was a little bit different. So it took me a little while, a couple minutes ago, to get familiar with it. They hold more fat. They're also.
How many pounds were they?
They were approaching 1,500.
Wow.
Yeah.
Those are big boys.
And they're built for sturdiness rather than like speed like a horse. So it's just everything was a little bit different. Things felt different. But yeah, we adjusted some show steer. So
Awesome.
we've now adjusted, in addition to our normal cows, we've adjusted guinea pigs. We've adjusted squirrels. I think Christina's adjusted.
Wasn't there sheep or something
Birds,
along the way?
goats,
Yeah.
rabbits. Like
Goats. Yeah.
Yeah.
Oh, fun.
Mhm.
Perfect. All right. So what's our topic for today?
We are talking about incontinence in animals. So something we see in our practice. Maybe not one of the major things we see, like limping, pain, things of that nature, but something we do see, and sometimes owners bring their animals in because it's sometimes a symptom of some issues in the spine.
Perfect.
Mhm.
So what is incontinence?
So incontinence more or less just means kind of uncontrolled, the lack of control with the bowel and bladder and things like that. So some animals, like as they're getting older, they'll just start leaking. Sometimes it's a little, sometimes it's a lot. When it comes to the bowel, sometimes they'll just have accidents and not like have.
They don't know.
Yeah, they don't even know. They just wake up in it more or less. So it's more or less just that they're having bowel and bladder movements without really knowing it or having pretty much no control of it.
And I would say urinary or peeing would be it's more common than having stool incontinence.
Yeah.
I mean, we've seen both, but I would say the urinary portion is probably predominant with incontinence.
I would say so as well. I mean, usually we would see the urinary before the stool type of issues. So yeah, I would say urinary is much more common.
Perfect. And what are some of the main causes or symptoms of incontinence?
So there are a number of causes. The ones that people come to see us for tend to be spine related. So basically what we're doing with chiropractic is we're seeing how parts of the spine are moving, if they're in the right position, wrong position. If we find an area, it's a super gentle correction. But when those areas aren't moving right, it can build up inflammation, which can put tension on the spinal cord and the nerves. The spinal cord and nerves control everything in the body, so including the bowel and bladder. So a lot of times what it can be, so one of the things, we see multiple reasons in our practice at least. Some of it is just that the nerves are, let's say they're probably a little bit inflamed, a little bit of tension on them because parts of the spine aren't moving too well, and so then the animal will leak because the brain basically can't control it to some extent. And the other thing we sometimes see is that when animals are in pain, they don't want to get into a squat position because it's hurting, so sometimes they'll just have accidents because of that. They know if they go out to go potty, it's going to hurt, so sometimes they'll go on themselves. So sometimes, but they all kind of relate to spine issues.
Correct.
Issues of spines and things like that. So with respect, did you want me to go kind of into some of the neurology of it?
Yeah, I think we should.
Okay. So the bladder is controlled by the nerves. So you have what's called your sympathetic nervous system and your parasympathetic nervous system. We won't go too in depth as to how that is, but the sympathetic nervous system, some of the nerves are derived from an area of the spine called the lumbar spine, and that's usually somewhere around the mid-spine area in dogs, a little bit lower. So issues there can affect the sympathetic nervous system, and then also areas in between the hips in an area called the sacrum. Those nerves are involved in what's called the parasympathetic nervous system that also sends a nerve supply to the bladder and things like that. And when you have an area of the spine that's not moving well or in the wrong position, like I said, it creates inflammation. That inflammation puts tension on those nerves. Now all of a sudden those nerves aren't working the way they're supposed to. It's kind of like an electric wire. I suppose if you cut it or nicked it, what it's supplying isn't going to be 100%. So ideally correcting.
There's a question.
Okay. Well, let's finish this.
So yeah. So ideally, in animals, the ones that we've seen improvement in incontinence related to the spine, we go through, we adjust the spine. Over time, the inflammation moves out. We take tension off the spinal cord and nerves, and then ideally, we start to see some improvement with the incontinence issues we see. And oftentimes, we have clients come and they know it's time to come see us again because the animal starts leaking again.
Right. Good characteristic, like markers or indicators of when that's needed again. Good. So one of the things, let me just circle back around before we answer the question that we have online, is some of the symptoms are just leaking.
Yep.
Or I have noticed or have heard with animals, it's right when they fall asleep, they express their bladder, but they don't know it, or it wakes them up. Like they go and then you can almost see remorse in animals. They're like, oh no. Some dogs will try and lick it and clean it up to try and hide it. Or like you said, dogs will just wake up and the stool is there in their bed and they have no idea that happened. There's no indication that they need to get up and go to the bathroom anymore.
So basically, like I said, the nerves that when you need to go to the restroom, it's because there's a nerve in your bladder that travels back up, hits your spinal cord, goes up to your brain and says, brain, I need to go potty. So basically the system in these animals, it just isn't working the way it should.
And unfortunately, I mean, it happens in humans as well.
Oh,
so even traumas, if there's a tumble or a hard fall, sometimes I've seen that bring on incontinence. I've also seen dogs, young dogs even, unfortunately, with maybe a spay that wasn't done properly, and that has had young dogs have incontinence starting from a very early age. My husky actually started when she was about 6 years old, all the way up until her passing at 15, but we were able to manage it with supplements and good explanation. Okay, so Lewis has walked away from the phone, so we're going to continue and go back to that question here. So the next question was how can chiropractic help with these incontinence issues? What does it do to the spinal column that allows it to help?
So, I'll start off by saying there's animal research coming out on animal chiropractic. We've had Dr. Cole and I have had a few papers published actually on paralyzed dogs, but one of the ones we've seen so far, it's a research paper published in 2015 in the Journal of Small Animal Practice, was actually published on incontinent animals, and basically it's called Chiropractic Abnormalities of the Lumbar Spine that's significantly associated with urinary incontinence and retention in dogs. So the reason I bring that up is because there is actual, to some extent, some research in a published journal on it.
Which is fantastic.
Yeah, which is fantastic. And there's not much yet. So incontinence seems to be something that, besides back pain and stuff we normally see, seems to respond well. And we see it in practice too. But what we're doing is, so just like body temperature or things like that, there's a normal range of what's normal and abnormal. So in the spine, the same exists. There's normal and abnormal. And the farther you get away from normal, the more you start to have issues. Again, like I mentioned, inflammation, a combination of other things that puts tension on those spinal cord and nerves. So what we do is we very gently motion, we're feeling for heat, any indicators that area of the spine is off. And so the spine is basically a bunch of building blocks, one after another. And we go through and we find an area that is not in the right position or not motioning well. It's a quick adjustment, very gentle. And then over time, that should restore the normal range, the normal biomechanics of the spine there, which will, again, take tension off the spinal cord and nerves. So ideally, like I said, we're just making sure the spine's in normal alignment, and if the spine's in normal alignment, then everything should be functioning optimally, and if everything's functioning optimally, then we shouldn't, if it's an issue related to the spine, it should show improvement with incontinence and things like that. Does that answer the question completely?
I think it does.
Okay.
I think it does.
Okay.
And in conjunction too, I mean, sometimes I just think it's good to mention that if you're already maybe doing a medication, because there are some prescriptions that veterinarians will prescribe for incontinence, that chiropractic can, sometimes they don't work. I've heard where, dogs will end up on 2 or 3 different medications trying to find the right combination to quell the bladder incontinence, and sometimes adding chiropractic onto that is never harmful in that realm of trying to get some relief, especially for the pet as well.
Yeah,
so.
And that's a good point, because we really, I mean, if you're taking the meds, I mean, in theory, we don't want to ever take a medication long term. There's always probably some form of side effect, whether it's minor or major with certain things. But yeah, adding chiropractic on top of that to see if it will help can be beneficial, because then if it is improving, then you can wean the medication down.
Sure.
And who knows, maybe even remove it if your primary care vet thinks the dog's doing well enough without it. So
yeah, absolutely.
Yeah, if you do have an animal that's on it, you can add chiropractic care to it as well and see if that'll, enhance the benefit.
Fantastic.
More or less, yeah.
Perfect.
All right.
So we have a question. What is the question?
Yes,
Liz?
Lori Roderick would like to know, how can it help if it's due to hormonal or spaying before maturity?
Mm-hmm.
Can chiropractic help?
So it just, again, it comes back to whether or not it's related to the spine. There's only one way to know, and that's honestly to do an exam and adjust. Most animals, if they're going to respond very quickly within like 2 to 3 adjustments. I'd say 95% of the time we see improvement within a few days of the initial adjustment.
Mm-hmm.
So with those type of conditions, we're more or less just trying to see if it makes a difference. Nothing's 100% effective, and if it's not, there's always more strategies. And if it's more on the hormonal side, biochemical side, then that might be where supplements or something comes in.
So I think going back to that question a little bit, Grant and I actually had a case or an animal last year where it was a Doberman. She was about 6 years old, and she started having incontinence issues that was right after the spay, and they were pretty severe. So by the time I had a natural health appointment with the owners, the dog was about 6 years old, and at that point the leaking and the dripping was nonstop and constant, to the point that dog pretty much wore a diaper every day, all day, because otherwise it was a lot. Even during our natural health consultation, she was able to fill a whole diaper just in the hour and a half appointment. So, and they had never been able to get it under control. They were at like max dosage on the 2 or 3 supplements or 2 or 3 medications that their veterinarian had given them. Between our natural health consult and the supplement program we put together, as well as the adjustments from Dr. Grant, we were able to reduce the dripping dramatically. To the point that she went 2 to 3 hour time spans without even having to wear a diaper. So, and that was within 60 days. So a dog that had been having massive urinary leakage for 6 years went from that to having time spans without a diaper on at all in just a few weeks.
Mm-hmm.
So there's definitely things that can help, which kind of is a great question that leads us into some supplements. So I pulled just a quick basic 4 supplements. There's actually quite a few different things depending on your pet's needs and individualized program, but I pulled kind of the things that I thought are kind of go-tos or knee-jerk supplements that we typically recommend here at the Pet Bistro. My favorite for incontinence, both stool and urinary, is number 1 cell salt, which is calc fluor. So number 1 cell salt has everything to do with elasticity. So one thing that chiropractic doesn't totally help, because it's more spinal health, is it doesn't help with those elasticity issues. So there's sphincter muscles at both the bladder and the rectum in order to make those bowel movements and the urinary issues happen. And if the elasticity is no longer there, this actually helps with it. So these are fantastic. They're inexpensive. Most dogs don't have a problem taking them. Cats don't have a problem taking them. I was going to mention too, I would say, have you ever dealt with a cat with this? We've had a couple cats with incontinence, but it's more dog, it's more canine.
I've had some I've had male cats, but it's not leaking. It's actually the difficulty going. So yeah. I worked with a couple cats where actually there were problems around the hips, the sacrum, and there was some pretty big muscle spasm through there, and I was like, even me, I was like, whoa, that thing. Adjusted it. The owner reported, like within a few days. Now keep in mind, this animal was like, could not go. And apparently it's a pretty common, she works at a holistic vet, so she told me it's a pretty common issue with male cats. They often thinks it's, crystals or something like that, but this case wasn't. But she said it was almost like a fire hose shooting out, and then within like 2 or 3 adjustments, she said the cat was back to normal. So
just fantastic.
Yeah, with cats I see less leaking. It's more on the opposite side.
Yeah, I was going to say,
kind of not going at all.
That's my experience as well. I've found that it's mainly canines over felines. So, okay, moving on to the next supplement. I'm going to switch spots here. Corn silk. Corn silk is number 1 supplement used often for bedwetting, even with children. So corn silk can be very, very helpful for our cats and dogs, mainly our dogs here. It looks like that has a lot of leaking and they don't know what's happening. They fall asleep and then all of a sudden there's a puddle. So corn silk is one of our favorites. Herb Smith, their bladder care. So maybe it's not that it's a hormonal urinary incontinence issue, but maybe it's more an infection. So sometimes we have bladder infections, or UTIs, or even kidney infections that can affect the whole urinary system. So Herb Smith's Bladder Care, this is a combination of cranberry and D-mannose and a couple other herbs. So this can be really helpful for managing urinary, just the overall urinary system. And it's a great all the time, something you can use all the time as well. And then we have uva ursi. So uva ursi is often used for animals that have more bacterial UTI type issues rather than leaking or incontinence, but sometimes those things go hand in hand. So, you know, these are just kind of our knee-jerk suggestions. Every combination of herbs and supplements, you know, we try and put them together based on individual needs, just because, you know, there's CoQ10, there's KBC, there's 5 or 6 other supplements that I didn't even pull that can always go in combination with maybe another one that actually works best. So there's lots of ways to support the urinary system. I think chiropractic is huge when it comes to the urinary system. One thing that from my end of the spectrum, from the natural health spectrum, is that sometimes what happens is that sacrum gets locked, and that can get and that's where it gets tucked under, and then it doesn't have free movement anymore. And once it gets locked, we have this whole hip lock action that happens, and it's difficult for, you know, this is when things start manifesting because nothing's moving correctly anymore. And we have the cerebral spinal fluid that has to come down and bathe our entire spinal cord, and if it's not bathing the sacrum as well and getting oxygen and nutrients to the sacrum, then it just starts compounding. And the sacrum can get locked from a myriad of different things, whether it's traumas or accidents or tumbles. You know, our older dogs, sometimes they tumble or they fall off the couch or they don't have their footing right, and it just kind of, you know, progressively everything kind of snowballs and happens all at once, and then it's trying to figure out what it is.
Well, I'd say even just slipping on hardwood, you know, something like that. I mean,
Yeah.
there's a lot of animals slip on hardwood, splaying, and then you put a lot of pressure on the sacrum.
Yeah, for sure.
Mm-hmm.
So let's, you want to double check and see if we have any more comments. So that kind of wraps up our incontinence session today. We have quite a bit of good information, and hopefully this has been helpful for you as well. Next week we'll be back here next Wednesday again, more probably towards the 1 o'clock hour. But next week we're just going to talk about overall general spinal health and what we can do just to keep the spine healthy from beginning to end. And I'm sure we'll come up with a bunch more tips and tricks. So to wrap this up, if you could give me a quick rundown on how somebody can make an appointment if they feel like chiropractic could be helpful.
Sure. And like I said, I pretty much, if you're going through something and nothing else has worked, it's always worth a try. It's very general. There's no cracking, popping with animals. They respond quickly if they're going to, and even if it doesn't, let's say, improve that issue that you came with, oftentimes it'll improve other issues you weren't even aware of. But if you have any interest, you can visit our website, www.advancedanimalchiropractic.com. We have a Facebook page. For appointments and things like that, you can give us a call at 248-602-0807. If you are in the general area of Madison Heights, you want to, if you're a customer at the Pet Bistro and you'd like to see an appointment, you can give them a call as well. We are here Tuesday evenings from 4 to 8:20, roughly. Wednesdays 10 to 1, Thursdays 4 to 7, and 2 Saturdays a month. So there should be something.
There's always availability.
Yeah,
even sometimes same day or same week. There's always availability.
Absolutely. So yeah, the initial visit runs roughly 20-30 minutes. We do a history, kind of look at some posture gait analysis, adjust. I'll let you know what I'm adjusting, but we send everybody a report as well.
Which those are very helpful.
Yeah, and then so we can always track progress too based on what we're seeing, and then make some additional recommendations on supplements, things like that, because taking care of the spine is what we're good at. It's a structural issue. It's the foundation of your body, more or less. Everything connects to it to some extent, but you still need some building blocks, some nutrients, sometimes depending on the condition, to kind of help restore the foundation, if that makes sense. Yeah. So, but yeah, pretty good availability here. Should fit. I mean, now the winter's hopefully ending soon. Should be even easier to get here without the snow and ice and everything.
Right.
So, but yeah, a lot of availability.
Perfect. Perfect. And then just one more quick thing to add is here at the Pet Bistro, we do offer buy 12, get 1 free chiropractic. So you don't have to purchase them all at once. It's just accumulative. So we keep track of them electronically for you. So that's an extra perk that we offer here at our location at the Pet Bistro. And I think you covered everything. You covered cost, you covered length of appointment. Those are, I think, some of our main ones.
Mm-hmm.
But you can also, if you think about it at 11 o'clock at night, you can always go to our website, thepetbistro.com, and at the bottom there's book an appointment. You just click on that and it walks you through their schedule, so you can pick either one of the Dr. Christina Cole or Dr. Grant Tully and make an appointment. But if you do have any questions, you can reach out to Advanced Animal Chiropractic, or you can always call here at the store, and any of us would be able to happy to help you. Our number is 248-548-3448. So fantastic, good talk today.
Thank you.
Louis, do we have any last minute comments or questions? Okay, we don't have anything, but if you guys think of something, put it in there, and one of us will circle back around, and we'll be sure to answer it. Everyone have a great day.